Hey guys, Dr. Devine here from Devine Chiropractic. Come on in, we're going to show you what happens in an exam room. This is an exam room here. Basically we have all the tables that have been sanitized. So obviously with COVID we understand that people are really concerned as we are. So during each patient visit, before the visit, we're all washing our hands, sanitizing the tables, and taking temperatures on every patient that comes through here. So what causes degeneration in your spine is three things: poor posture, trauma, and stress. And it's almost like if I break my arm, I put a cast on it, and 10 weeks later what happens is the bones magically knit together and they come together due to the cast keeping things immobile. So the body senses immobility from the cast and it brings calcium where that break is and it just kind of knits up there. So same thing happens with your joints. When I'm checking your spine, again it should be nice and springy. When I come in an area that's really tight, if left uncorrected over time, the body senses there's almost like a pseudo cast on that area. What happens is it brings calcium in and that's what causes fusion on your joints. So what we do as a chiropractor, once we find an area that's stuck like that, we manipulate it or adjust it, and that slows down and a lot of times stops that decay process. So a normal joint should be nice and loose and flexible, and in between your spine you have what's called a disc, and your disc is like your cushion or your shock absorber, and the nerves that come out between your spine, there should be nothing occluding that. So anytime the spine gets out of alignment or becomes excessively degenerative, that puts more stress on the nerves, which can cause symptoms. So typically people come in and they come in because they have pain. Only 3 to 5% of the nerves in your body are pain sensitive. So it's good that they're coming in when there's pain, but typically the problem arises way before the pain comes. If you think about it, it's like you can have 3 cavities in your teeth or your mouth and not have a toothache until one day you wake up and you have a super bad toothache, and then when you do, you call the dentist. But the tooth didn't go bad overnight. It just finally touched what we call a pain-sensitive nerve, which gave you the pain response, which made you act. But typically, the problem's been there long before. So when somebody comes in, we have 3 parts of a treatment plan. The first goal is to get them some relief and get them out of pain. Goal number 2 is to correct it or realignment. And then the last goal is to strengthen it out. So again, we palpate to figure out how springy that joint is. If we come in an area that's stuck, we make a correction, we adjust it, your body releases synovial fluid, which is almost like WD-40, really slows down that decay process, and a lot of times it stops it. So getting adjusted on a regular basis is very, very important.